So part two of the video. Let's just start off with just a few minutes of housekeeping here. And that is going to be, if you've noticed, I added another for week 5. And the reason being, I'm not sure. And if you've noticed, I've marked things that are green here to kind of show you what's coming up. I mentioned this before, but I want to say it one more time. I'm basically building this class as we go. Um, I feel it's working fine. I hope on your end you're feeling good. No one's emailed me or anything in concern of. I feel like there's not enough going, it's going that I can be doing or whatnot. But I'm really trying to put this class together because I'm building it with Linnea stuff, which she used to do, as well as what I think is important, as well as why we did the first 3 weeks the way we did, so I can see, what do you want to learn? What is important to you? And hopefully you're starting to see that reflected in what we're doing. Like right here, I'm going to do another one of these because I want to talk about some of this stuff. Like what does a typical day in nursing school actually look like and things like that. So I'll do that probably next week. There won't be a lecture from me every single week, but I felt that it was important that I do that there. So I just wanted to kind of explain that. So that is going to be next week. This is this week. Sorry. It's the 23rd today. Okay. So we already went over some stuff. So let me just tell you what we're going to be doing. My goal is I know it's hard to listen to lecture sometimes over the without seeing the mannerisms and all of that, and being in person as well. So let's go ahead and do this. I'm not going to spend a ton of time on this part, not because it's not important, but because you've had a video. I also put the extra credit video worth up to 5 points. By the way, excellent job so far. A few of you have turned it in. And just in general, I think I said it last time, very impressive work. Like I'm feeling really good about the work I'm seeing, and like there's the time that's being put into it, and the critical thinking that is already there. And critical thinking is a huge part of being in nursing school and being a nurse. And kind of, even as I mentioned before, learning a new way of thinking. And you will see that very soon. So let's go ahead, and I will spend a little bit of time on this because there are a few that I want to mention and give a couple of examples just because I think that helps. But then I want to go over the NCLEX questions, not just because it does kind of go with another assignment here. You can still do it because they do ask, like, what do you think about the questions? But it does make it a little bit more difficult. And I did not realize it didn't even click until one of our students, which thank you so much. Please, if you ever see something, I am a human being just like all of you. I am not perfect. I may miss a date or something. So as you can see, that's why I pushed out this assignment, because really it goes with this one here. Me explaining it and there, hope that makes sense. So please, if you have questions, if you need an extension, just all of that. And if I've mentioned this, I teach 13 classes, so I don't always know what I've said. So let's not waste any time, and we'll just jump in here. And this part will probably take, I would say, 15 minutes. And then the NCLEX questions about, I don't really want to get too into like, how would I say? Because you're definitely intelligent enough to take in the information, but this is not an NCLEX course. So this one I'm going to keep a little more light. And then as we go on, I will add other NCLEX questions. So at that point, I may give more tips and tricks, but I will add in some today. So I would say this video total should be no more than 45 minutes, which I think is pretty doable, especially since I moved the date out here. All right. So therapeutic communication. So therapeutic communication in general, we tend to use just that word in general with nursing. Now, that doesn't mean it's a specific, of course it means it's a specific type of communication. Hey bro, what's up? That's not really therapeutic. Yeah, therapeutic communication does have a purpose. However, I mean, we can be therapeutic with our family, with your friends, the way you're speaking. It doesn't have to necessarily be in the world of medicine, right? And the profession of nursing. However, I do feel that it is an extremely important technique, and I do use it a little bit interchangeably, and so do the videos too. And pretty much most of the people that I know, because I've been doing this about 15 years. So when I say therapeutic communication, please keep in mind it is purposeful. There is a purpose why we're doing it. And you'll see here right now with the first one using silence, like, why do we do that? There are actual forms of, so this is, I guess, the best point to distinguish what I'm trying to say. There are actual techniques that we can use, and we'll talk about like using silence, body language. Those are actual techniques. But then in general, if I say therapeutic communication, so let's say you're a nurse, I think most people think of mental health. That's a big one. They think, oh, therapeutic communication, mental health. Well, no. I mean, if you're working in, let's say, a pediatric clinic, I'm just making this up while the story, that part was not prepared, but I think an example would be helpful. Let's just say you work in a pediatric clinic and you are an LVN or an RN, or we'll say you're an LVN. Let's say you just got into graduated, everything's great, and you're working with, the dad brought in a 4-year-old, his 4-year-old daughter, because she's had a fever. And so the communication that you're going to have with the child as well as the father, that's considered, I mean, I hope you're using therapeutic communication. You're not even thinking about it though. You're just doing it. It just becomes natural. Same thing if you're working in med surg and you walk in to give a medication, let's say through one of the patient's IVs, and it's pretty early in the morning. Therapeutic communication, and tone of voice, huge. Oh, good morning. How are you? How did you sleep? And I'm kind of just talking to myself here. The patient may say, I didn't sleep that well. It's just hard with all the beeping and whatnot. And as a nurse, my response would be, I am so sorry. I understand that with noise, it can be difficult for certain people to get some sleep. If you're interested, I can potentially, because we do need the machines to keep you safe, potentially we could put you on sleeping medication while you're here. We have some that does not have the potential to be habit forming. We have other types, or if you don't have any interest at all, of course, let me know, because I'm trying to validate that I'm hearing my patient. And by the way, I'm already going through, I've already gone through, I think, 3 things on this page or in this huge packet. So I won't go over them when I get to them. And I'm validating. I think that's one of my favorite words in nursing is validation. And again, it's not just a mental health thing. And we are so busy. But in my experience, if you take the time up front, instead of, I gotta get it, whatever, you're running around and you're not really dedicating that time to solving the problem and doing an intervention so that you have a best outcome. In the end, you're actually, I don't want to say wasting, but not utilizing time well as patient care. So hopefully that kind of puts in your mind what I'm trying to say is, of course we want best outcomes for our patients. And the patient may say, and we're of course not always going to have happy patients that we're dealing with. And the patient may say, oh, no. I totally don't want to take any more meds. I'm taking enough meds. I hate taking meds. I don't even want to take what you're giving me right now. Let's say I went in to give an antacid. I'm just through an IV Protonics. And then I would respond back with, okay, not a problem, but please let me or any of the other nurses know if there's anything that we can do, as long as we keep you safe. And I appreciate you sharing what you shared with me. That right there, all of what I did, my tone of voice, how I responded. Now, of course, you can say one thing 100 different ways. It doesn't have to be the Amanda way. I'm just giving you an example. Okay. So, no, okay. So definitely we're going to talk about number one. This one is very difficult for me. I don't like silence like in between. If you know me, you know me. I could talk for 18 hours straight. It's an art form. In general, this being a nurse is an art form, but breaking it down using silence. So it's like, okay, why? And it tells you here, but it really does help. And it could be, I want to give a couple examples real quick here. And by the way, again, we're not going to go through like this with every single one. I'll probably pick, well, in my mind, I've already picked 5 specific ones. But silence in particular, let's say you have a patient who is on a medication, which is causing their cognitive level to be a little bit more slow. And that doesn't mean that it's a mental health patient, doesn't mean anything. They may be on pain meds because they had a knee replacement. So using that time to allow the patient to respond to what you're saying. And again, we're all human. It can be at certain times a little bit, I don't want to say agitating, because I don't feel that that's respectful. It can become a little bit like in your head, you're thinking, oh my God, I have 527 things to do. The call light's going off. My CNA needs me. There's so much going on, but I want to hear what my patient has to say again, because A, that's my patient. B, I want to put that time up front. And if you don't have time, so I'm going to interrupt this conversation about silence. If you don't have the time in that moment to have a conversation with your patient and it's not emergent, there is nothing wrong with letting your patient know and saying, I do have something that I need to do, but what you have to say, I want to hear. So I know that you have a lot of questions about your medication, which I think is great. And I want to make sure that you understand when you go home, because I know you're being discharged, that you get that time that you need to ask any questions. I'm looking at the clock now. I see that you're going to be leaving within the next 2 hours. I'm going to come back in 30 minutes and we'll go over your medications. Does that sound good to you? And even if they say no, if you really have to do something that's emergent, you got to do what you got to do. Now, if you still don't have time at that time, come back in 30 minutes or send somebody, because that's rude. It's just rude. And I hate it. It sounds odd, but nursing is some type of a customer service in my mind. Now that's debatable. And I'm not saying that I'm there to make the patient love me and I have to be the favorite person in their entire life. However, imagine yourself, and I'm sure several of you have had procedures or surgeries or, it feels good to feel cared for. And hopefully it's coming from a real place. And I may come back and say, I'm almost ready. I'll be back in 15 more minutes and we will continue. So anyway, I want to put that in because that has to do with communication and building rapport and trust. The more rapport and the more trust your patient has within you, in my experience, and I'm almost positive that this is evidence-based because I'm pretty sure I read tons of articles. Excuse me. But they're going to divulge more information for you. And the more information that you get from a patient, I'm not talking about like their cat's name. Who knows? Maybe that would be important. But the more information that you get from your patients, usually the better that you can help them. Therefore, the better that you get a better outcome. And isn't that what we want? The patient to feel better, the patient to come back for their follow-up, the patient to take their medication correctly, all of that. So the more information, the better. We might find out we're sending them home with no help and they're maybe too stoic to say anything, or there's rugs they can trip on. So all of these things all come together. All right. Back to silence, awkward. It is because we tend to want to fill that silence because most of us, that's our natural tendency, not to have silence. But read over this, and I think I mentioned the importance of just allowing that time. And sometimes somebody may just be like myself. Oh my God, Wednesday? I could not think to save my life. And I was teaching clinical that day. And even one of the guys that works there, that's one of the counselors, even asked me, he's like, "Are you okay?" And I told him, I'm like, "I feel foggy." So sometimes just people feel foggy. So anyhow, point being, we want to give silence, because if we don't, and we're like constantly interrupting, or it makes it look rushed and like we don't care. I think I said enough about that. Love this. And I'm sure you've all, body language, letting them know that we are hopefully listening by just doing something. I'm a huge, I lean in, not too close, because I don't want them to feel like I'm impeding on their space, but I do it so naturally. I don't even know I'm doing it, that and my tone of voice. So if you're ever in one of my nursing classes, when you get in, and I teach several classes, but mental health specifically, and I have a nursing voice. If I'm doing anything having to do with nursing or give an example, you'll even notice it here. My tone changes, all of that. It becomes you. It's actually very beautiful. If you can't tell, I really love being a nurse and soon nurse practitioner. Okay. Giving recognition. I think this one's they're all somewhat self-explanatory, but I'm not gonna, we could be here all day, right? Offering yourself and making yourself available, to me, that has a lot to do with kind of letting the patient know that you have time. I love the examples that they're giving here. I think they're really helpful. And another reason, just so you know, why I love to post this, and if you do get into one of my classes, you will see this again, because it kind of helps give you ideas of one of the top things I hear before we go to a mental health clinical is, "I'm afraid I'm going to say the wrong thing." And I know I keep saying mental health, but again, this can be used all through everything, is I'm afraid I'm going to say the wrong thing. Well, first of all, you could say every single thing that is, supposedly correct, and everything could still go to, down the drain, if you will. You never know what could potentially set any patient off. Mental health, not mental health. We do our best, and then hopefully are able to repair it. But humans are humans, and just like somebody that's in the hospital, being in the hospital usually isn't like a fun time. Although sometimes I will joke and say I kind of wish someone would hit me with a car. Just that's not suicidal ideation or anything, but so I could get a little vacation. But I'm joking, right? Most people don't want to be in the hospital, so they may not be as pleasant depending on what medications are on or how much pain they're in. My goodness. And not being able to, you lose a lot of your independence too. So again, looking at all of this comes back to how therapeutic communication can potentially, I've seen it. That's why I'm so passionate. I'm saying it so pressured speech, meaning I'm really into it, because I have seen this work. It's amazing. So offering yourself, would you like to have a seat? Being interested in what the patient's saying. This is huge. So as you can see, we're going through this fairly quickly, because these ones are pretty self-explanatory, but giving broad openings. This is kind of the rule to therapeutic communication, is not saying why, close-ended, open-ended, can you tell me more about that? And you'll see it in the questions as well. Now, that does not mean that a therapeutic question cannot be, it doesn't always have to be. I don't want you sitting there with a patient thinking the entire time, and then you're not even listening, thinking, oh my God, what am I going to say back? It has to be open-ended. And it just becomes so anxiety ridden. Now, on the board exam that you're going to take on the NCLEX, if it came up, and I will talk a little bit about the NCLEX, I will talk about it more later, but I'll give a little bit of information after this video and before we answer the NCLEX questions. But in general, open-ended questions are very much encouraged for therapeutic communication because it gives that opening for a patient, again, to give you more information and also not feel interrogated. But at the same time, as a nurse, I mean, sometimes we need to know, like, how old are you? Or, get that information. So just kind of keep in mind broad openings, and hopefully this will help in your life too. Work, with your partner, your kids. Yeah, I was gonna say your animals. And I'm sure at least one of you is laughing right now because I talk to my animals, and yeah, I have 4 dogs, so I think I mentioned that. I'm surprised they have not barked yet. Okay. So broad openings and broad questions, but also, may I just say something to that? Letting it be natural, because I mean, I know for myself and sitting with patients, and I sit very comfortably, and my body language, I don't want them to think, especially, again, I'm going to go back to mental health, but if, anywhere, like, I'm comfortable, even if I'm not comfortable and I'm a little nervous, that I'm comfortable and that I'm there. And I'm not just there to get something necessarily done, but I'm there because I care and I want to get it done, but I want to get it done in the best way possible. So, I don't know exactly where I was leading with that, but just, that the broad openings really help. Oh, not that, this is why. Not having it seem fake. That we're just doing this like weird kind of like robot talk, and it sounds like every question you ask, tell me more. Oh, so what do you think about this? Or, we want a good flow. Let's just put it that way to the conversation. All right. And I know a lot of you are CNAs and home health care and have, regardless of that, which is wonderful that you have those certifications. I think one of you said something about phlebotomy. I'm trying to remember. I added a lot of people. I over added people to this class, but whatever. I want you guys to get your points. So you can get into our nursing programs, which, by the way, I mentioned, I mean, many more people are getting in at a faster rate because we have 3 tracks running at one time, which is bananas. Let me just tell you. All right. If you're confused, ask, and as well, like, sometimes it's really good to get the story correct. So, okay, what happened first? Because you can get a patient that has many things going on with them. Okay, well, what started first? The headache, and then vomiting, and this, that, the other. Because then we can give better information and we document correctly, or at least per what the patient stated, and then the NP or physician or whomever can make a better picture of a treatment plan. Observing, of course, your body as well as the patient's. Of course, we want to not like be looking them up and down, but just, do they look uncomfortable? And it's okay to ask somebody. There's nothing wrong with asking somebody, are you comfortable having this conversation right now? And that A is open-ended, and I just did my nursing voice. And if you could see me, my body language just changed. Again, it will become within you. It's awesome. I'll let you guys read all this on your own. There's just a couple more. I think there's 2 more I wanted to go. I love restating. Restate. You may have misinterpreted what a patient has said to you. So by, again, not robotically, but kind of getting the idea. So I think this is what I'm hearing from you, that you're saying that you're feeling upset because the physician didn't speak with you about this medication that is now being sent home with you, and you have no idea why this is happening. Okay. Okay, that makes perfect sense. I'm more than happy to sit down with you and speak about the medication. That may have not been the best example, but that just popped in my head. So, but I think you guys get what I'm saying, because sometimes we don't, for many reasons, just we're human. There may be a slight language barrier. We have many people, not just in our program, but our patients that they take their language that they learn first and have to translate it into English and then have a conversation. So, just making sure that we understand is, of course, very important. And reflecting. This is just part of conversation stuff that we just do. Exploring if we need to get more information. Of course, giving your information as far as who you are. And I mean, that's all very therapeutic because that shows you care. These are the rule, not rules, but, per the facility, this, that, the other. Seeking clarification, that's very similar to reflecting, but so I'll just say that, but clarifying. Presenting reality. I'm not going to get too far into that one, only because that one has a lot to do. That on its own is like a 20-minute thing, but that goes from presenting reality of mental health versus maybe somebody who's sundowning and has dementia. It would be handled in two different ways. But so I'm not going to get into examples with this. So we'll just keep it as presenting reality to somebody who is cognitively normally intact. These would be things we would utilize. So just take a quick look at that. But hopefully I will see you soon and I can give you examples of the other ones. But basically it's called reorienting. Most of you probably have learned this, but what I mean by that on the other side, so if somebody has dementia, for example, and they're diagnosed with Alzheimer's, that's a subcategory of dementia. And they are, sitting in their favorite chair, and you just happen to walk by and start a conversation or just ask, how you doing? Can I get you anything? And the patient says, oh no, I'm just waiting for my daughter to come pick me up. And that the patient doesn't have a daughter. The daughter, let's say, has passed away. The history of this patient's been there. With that type of situation, we don't we kind of the rule of thumb is we don't reorient. We say, oh, okay, that sounds lovely, but we don't feed into it more because more than likely the patient will forget. Now, of course, if they start to get agitated, we have to read the room. Things change so quickly. That's why one answer just never fits one thing and doesn't fit all, which is one reason I think why I love nursing so much in this profession, just because it is so, it's art, and it's really being able to, you're a magician, you're everything. You're everything. I don't know who watches TikTok, but if you ever watch Nurse John, that's the friend of Nurse Blake. He makes a video and he's like, you're the plumber, you're the therapist, you're everything. And it really is, quite frankly, true. And no matter what area you go into, it kind of ends up being like that. And I mean that in a positive way, not a negative way, because we are so important. Everyone is, from CNA. I will always say this, from CNA to the top surgeon in the hospital. If we didn't have someone to clean that room, if a custodial unit that did a good job, one of our patients could die of a horrible infection if any of that infection was left in there, and we have a vulnerable patient coming in after surgery, right? Everyone is important. And I just have to say this because we're almost done with this part. Feeling valuable, and I have a video on this, but feeling valuable, and I'll probably show it to you so you'll hear it, but having that sense of value. And for example, I love, and it's very important for me to know people's names. So when I go into my clinical sites, and I tend to go to like the same, 4, I make sure to ask people's names. Now, what I've noticed personally, people, they don't ask the custodial team's name. They don't, I'm not saying they may not acknowledge, But I mean, I go to Momentum, for example, on Wednesdays, and I won't say her name just for, it's not HIPAA reasons, but just because I think that's polite. She is amazing. I don't know how she keeps it so, I mean, that place is spick and I mean, it is so clean, and she does such an amazing job. And her face lights up when she sees me. And I think because she's just a nice human being, but also because she feels validated. And I will tell her, I'm like, oh my God, the bathroom looks so good and it smells so good. And I thank her for her work. I know I'm getting a little off course, but I think all of this matters with nursing. And I know that before people get into nursing school, they're so hungry for it and they love it, like hearing, or at least I did. Just anything I could get or hear, I would just get so excited because I couldn't wait to get there. Hardest journey of your life, but it's also the most beautiful, in my opinion. Okay, anyway, so back to this. And I will do that quite often because I want you to hear these like little stories that don't necessarily fit in with another lecture, but also are, heartwarming and touching, and maybe the opposite. My apologies. I'm gonna pause it real quick. I think my groceries are being delivered and my chihuahua is not happy. My apologies. Yes, groceries were delivered. All right, let's keep going. We're just about done with this. And you'll notice some of these are very, very similar, which is why I'm not going over every single one, and you all know how to read. And that was one other thing I wanted to say when I was putting things up, because some things are not worth points. It's for you. And if you utilize it, you do. If you don't, you don't. Or maybe, hey, like I had mentioned, I think I mentioned in another video, to have a file. And hey, maybe I don't want this extra credit, but I want to save this video because I want to watch it later. Or I still watched this video or did this assignment, but I want it for later. That I would completely do that. I do that now in my doctorate program. I have a folder of things I know that I want to come back to. So just want to say that, like right now, do you really need to be listening to this lecture? No, you don't. But hopefully you're invested enough in your education. And I know it seems like so many assignments, but they're not super, super long. So I'm hoping, because I really try to stick to the 2 units, this, that, the other. Also, I don't know if I made the announcement or not. We will be having a quiz coming up pretty soon. I think I did. There will be a study guide. It's going to be very straightforward. I am not here to confuse you. I want everyone in this class to get an A. I'm not trying to make it easy. And that's why I'm mentioning, so I really hope that you're appreciating the information that you're learning and so forth. Okay. Here we go. Suggestions. Of course, we can make suggestions. And one thing, may I add, when a patient, because patients will often ask you, and nurses, it's a very big title, and we're very respected in the community, and just in general, nursing is a very respected profession. And so a lot of my patients and students actually will ask me, because I work in mental health, so they may come see me if they're having an issue. And I make it very clear, number one, I'm a mandated reporter. So because I've had to call several times for potential harm to self, harm to others, usually harm to self, if somebody feels like they want to hurt themselves because they're stressed and or something else is going on in their life. But another thing is, I always like to make sure to say my guidance, not you should. So that right there, that's a perfect example of therapeutic communication. So saying, well, you should do this definitely, and then you give your own advice. That's not therapeutic communication. Advice is not really something that I don't want to say it's not in our scope of practice, but that's not really, like right here, suggesting, no, sorry, where'd it go? forgot. I saw it somewhere. But using the word guidance or and in my opinion of what I've seen, I'm happy to give my guidance on, like, let's say you work in labor and delivery and someone just had their baby and you're noticing that the father seems or the mother seems very like stressed out and overwhelmed, and the husband asked me like if she won't breastfeed, and she really wanted to before. She was so happy to have this baby, and now she will barely look at me. She doesn't want anything to do with the baby, and may come up and ask me, which I mean, I would completely understand. Am I doing something wrong? What can I do? I wouldn't say, well, what you should do. And in this moment, because I don't want to make this video too long, I would of course start off by doing a little bit of education, and that would be with your wife just has had a baby. There's a lot of hormones going on. So I'm giving facts. So I don't need to say my guidance is, because I'm giving facts. These are all true. But then I could say there may be some underlying things going on. And again, the tone of voice and then validating him and say, and you could, just because this is not your direct patient, that person is still the patient. That's the father's or the baby's father, right? So having an open and therapeutic conversation with him, so hopefully he can open up, because maybe something happened. Maybe there was an affair right before the baby was born, but she doesn't want to say that. And that is a great example. I'm going to use that. So because if we don't ask, we don't know. Of course, we're not going to come out and say, hey, so did you like have an affair right before the baby? No, we're not going to guess. But by me having that conversation with him, that would help. I love when that happens, when you just make up stories on the fly and you're like, hey, I like this. Being reassuring and all of this. I feel like I don't need to go into any more of this. Okay. So I think I've done enough as far as like going through this, giving examples. So I do want to move on so that we can do our questions. And so I'm going to go ahead and go back, and we're going to go through the NCLEX questions. So now that we have a little bit more information and examples and some life experience and whatnot for that, for therapeutic communication, we will do NCLEX style questions. So, okay. Again, I'm not going to go into too much today of like the tips and tricks. So like, for example, I'll just give you like 2, and that's kind of what I mean. And this will actually help you as well to start to be better test takers in nursing school, because tests in nursing school are totally different. If I have not mentioned that, not only do you need to know the information. So if it's about blood pressure, you need to know the information in order to answer the question, because we're not going to be asking you, we're going to ask you questions in this style, which is, give you the background. Patient's blood pressure is 164/94. We all know that that's high. We aim for, the standard used to be 120/80. Now they're trying to save and lower. But we'll just say 120/80 for now. And this individual has been having, they smoke a pack of cigarette a day. And let's just say they give you a whole scenario. I have to take the information that I know, that smoking, having high blood pressure, and it's not controlled, and they're refusing to take their medications, and they have hyperlipidemia. If you don't know what that means, it is high cholesterol. That puts that patient at risk for a CVA, meaning a stroke. So basically my point being, because we're talking about the NCLEX and I said I would give some information about it, is you're taking stuff that you know. So on other tests, a lot of your other tests, it's basically like, this is a little bit simplistic, but what is the best blood pressure out of these 4? And then you pick that one, right? And it's a lot more memorizing. Nursing school is, you have the information in your head already, and then you have to apply it, basically. So that's that. And the NCLEX is a test that, in order to be an LVN, you have to take. So I took 2 so far. I have to take 1 more. I took my LVN one. And then once I was done with my LVN to RN program, then I took another one to become an RN. And then you can keep both, but I didn't, just because I didn't see, personally, I didn't see why I don't need them both, because you don't have both of them on your badge, and it costs more. It's not cheap, or yeah, it's not cheap. You have to pay for this every 2 years. So yeah, and renewal and all of that. So you renew your license every 2 years, except unless they've changed it, except for the first time, you it's easier. There's something easier, or I don't think you have to pay or something. I can't quite remember in this moment. My apologies. And you don't take another test or anything like that, which is great. Please, please, please don't ever not let the Board of Registered Nursing or the licensed vocational nursing, depending where you are at that time. If you move, you must let them know your new address. You can do that online. It's very, very, very important, because they're going to send a reminder that when your license is going to expire. And if you don't have the proper amount of CEUs, and I think it's, yes, 30 every 2 years in nursing, of course, meaning you can't do it on like how to change a tire. But although that would be a great skill, as well as pay a fee. And I just renewed it and I can't remember the fee, but it's a couple $100. But once you're a nurse, you'll be making, well, I don't know what you're doing right now, but we do pretty good. So there's some information about that. Basically, and I always forget, so please, my apologies. The NCLEX exam is for LVNs and RNs. It's the old way. So it keeps changing because of COVID. I think it's back now to the 75 or 85 questions is the minimum amount. I know you've probably heard, oh my God, there's a new NCLEX that came out. Because the point of the NCLEX is this: it's safety. That's literally what it is. So I didn't mention this, I don't think, but I work for Kaplan as well. And so I've taken 25, 35 hours worth of what is the NCLEX, how to take it, tips, tricks, all that, right? And then I've taught it to students. They hold classes. So haven't done it in like 2 years because I don't hold priority due to the fact of COVID and all of that. But still, great experience, and I'm glad I have the information, because then I can share it with you. The only other thing I want to say about the NCLEX right now, because I think we'll do more talking about that, and I want to get to these questions, is that, again, my apologies, I always get them mixed up, but it's only 10 questions. I think it's 85 for the VN and 75 is the least amount, and then the most is 265, somewhere around there. So you have an idea. So there's quite a large variable. And so what happens is, basically you take your test, and once you get to that minimum amount of questions, if you have answered enough passing questions, and I'll explain later on what that means, but like I mentioned earlier, if it's a very black and white question and there's no critical thinking involved, that's not a passing question. So that means that you're kind of not doing as well. So they're going to give you another question, and it's basically tracking you. And if you get to that minimum amount of 75 or 85, if you're above the line, the computer will turn off and you pass. If you're below the line, the computer will turn off and you will not pass. In the state of California, you can take the NCLEX as many times as you want. And I will say this: if you don't pass on your first, second, or third time, that does not mean you are not intelligent. That does not mean you're not going to be a good nurse. I just want to say that. I hope you do pass your first time, because I don't want to say luckily, because I really studied my what off, but both of them I passed at the least amount of questions first time. And because I think it would cause a lot more anxiety to have to go back in and basically have to take it again. And so, again, once you're in my class, hopefully, or anywhere else, just please study. Study for your exam prior. They have great resources out there, and we'll talk more about that when we talk more about the NCLEX. So I will also, the last thing I think I'm going to say 2 more things, then we're going to answer the questions because we're going to have a bigger NCLEX talk later. More people pass when the computer turns off at the least amount of questions. So if the computer, I've met not one person in my life that's ever left that was like, oh yeah, I definitely think I passed. Every single person says, no way, nope, I failed. Because honestly, that's how you feel like you're not getting anything correct. And then the computer shuts off and your heart drops to your, you know what, and you're just like, oh my God. However, if it doesn't turn off, your heart still drops because you're like, oh my God, I'm not doing good. But just please remember this. If they're asking you more questions, you're still in the game. That means that you are far enough or by that line of passing that they're giving you a chance. That's good. Okay, so that's the mini little NCLEX right now, and then we'll talk definitely more about it because I'm sure many of you are interested. Okay, so let's answer these questions and then we're done. So the first one is, the nurse cares for a young mother scheduled for a breast biopsy. The client tells the nurse, if I lose my breast, I know my spouse will no longer find me attractive. Which response by the nurse is the most therapeutic? So my advice here, my guidance, my advice really, is don't look at the answer choices. If the question gives you kind of a nice bulk, this gives me a lot of information. So I don't want to look down yet because I don't want to be swayed. So I'm going to look, okay, I have a young mother. And again, as we continue to go through these, I'll give you more like age is usually important. When was this? If they had a surgery, that might be important. Like all of these will actually help you answer the question, but we're not going to go there yet. I'll just give maybe a few. Okay, so number one, we have a young mother, so we know it's a young mother. What is young? I don't know, so that may not be as pertinent. What is she having done? She's having a breast biopsy. Okay, so I know that's not surgery. Okay, so I want to understand, why is she there? Is she there because, she's on the mental health unit because she had psychosis? Did she just have her leg amputated? I want to know what's going on because it's going to help me answer the question. These are all therapeutic communication, by the way. As well as I don't think any of these you learn, maybe one, you learn something, like something specific, but I chose all. To be quite honest, most questions are about therapeutic communication. Not all, but like it creeps into everything. Okay. So breast biopsy, this is scary. This woman may have something where many women have, a part of their body that they identify as, and not everybody, but identify as being a woman. And it's scary. And she just had, she's a young mother. And now the biggest thing, please do not make assumptions, don't read into it, and do not make up a story that is not giving you, or take your own experience, because just keep that for now. That was my hardest part, is because I will rewrite this whole story and then I'm going to get it wrong. So, and then I know that the client is very worried. So it's already telling me here why she's worried is because she's afraid or in fear that her husband's not going to find her attractive. So what can I say as the nurse in this moment to help her? Okay, now I've broken it down. So I've read the question, didn't look at the answers because it gave me a lot of information in the choice of the question. By the way, the other ones will go quicker. This is the first one we're doing. So I'm explaining why I'm doing it the way I'm doing it. And now I want to see, what do I have to work with here? And I very, very often don't just say, nope, not going to choose this one. Read them and read them carefully. So what can I say that's most therapeutic to this young mother? Letter A, I understand. Okay, first and foremost, usually, and there's an exception to every rule, and there's one in here actually, we don't start off a therapeutic communication with, I understand. Do you understand? Are you in this woman's body? Now I may say, and maybe not in this situation, but I can understand from my own viewpoint how I would feel. I would love to hear more how you feel so we can talk about this. That's just kind of a potential if you couldn't think of something else, another way to word it. So already I'm like, I don't like number one, but we're going to still finish reading it. I understand why you were upset, but after breast reconstruction, your breasts will look normal. Another huge red flag. So I already know this one is not the right answer. What is normal? Number one. And how does she know that they're going to look normal, even if there was a normal? So it's completely not therapeutic. I'm disregarding what the patient's even saying. I just am basically saying it because that's kind of like what feels right to say. And remember, if you've watched the, video I love, oh my God, I can't remember it. It's the one that's actually assigned, basically what not to say, but we want to say it so bad. So number one, I don't like. Letter B, wait and see what your spouse's reaction is before you get upset. Students tend to like this one. It's not the best answer because again, it's kind of condescending and it's not addressing what the patient is going through. We're not addressing her feelings, right? And we're kind of telling her what to do. So I don't like that one either. Let's see what else we have to work with. Letter C, you have concerns about how your spouse will think of you. Like there should be a question mark there. I like this answer. What did we talk about earlier? See, there is a method to the madness here of why we went over that. It's open-ended. I'm getting more information and then we can have more, dialect between the two of us. So far I like this one, but let's see what else we have. So right now, if I had to pick between A, B, and C, C is the answer, but I don't know what D says. So let's read it. You should, again, kind of like I understand. We try not to should people. It's bossy. It's basically telling, let me read the rest. And this is also another one that students tend to like. You should focus on getting well. Your children are young and they need you. Because I can understand why a student would choose this one who hasn't had very much experience with like answering NCLEX questions and whatnot. But it does not address the issue. And it's kind of telling her what to do. And that's not therapeutic. It's bossy. It's not guidance. It's not. Yeah, I don't think I need to say more. And please, if you ever have questions about these, you can text me or canvas me or whatnot. I'm more than happy to go into further detail. So the correct answer is going to be letter C. And then I always, just by the way, I then would always go back up, read it again just to make sure, because sometimes they'll try to trick you and they'll make it opposite. Like, what wouldn't you'll see, but they'll try to like say, oh, I can't, my brain fog. So right here, it says, which response by the nurse is most therapeutic? It may say, which one is the most non-therapeutic, but you read it wrong. So please, my guidance and advice would be after you actually pick one, then go back up and read it again just to make sure that you didn't miss something. All right. Number 2, now we're going to go a little bit quicker. An RN is caring for clients in the mental health clinic. A woman comes to the clinic reporting insomnia and lack of appetite. The client tearfully tells the RN that she was laid off from a job and she had had for 15 years. Which of the following responses by the RN is most appropriate? Okay, so first of all, they may say RN, LVN, or nurse. This is just to let you know. All right, so I know that we had someone come into the mental health clinic. It appears that she is in crisis because of the information I see. She's tearful, not eating, she's not able to sleep. That indicates potential crisis, and she's coming to the mental health clinic, and she just lost a job. I mean, 15 years is substantial, and I think they did that on purpose to show, I mean, that's a long time. So what am I going to say to maybe help her start processing what's going on? Letter A, losing a job is a common occurrence. No. This is very, very like dismissive, and I'm not addressing any of the problem, and it's kind of rude. I'm just going to say that it's rude. And by the way, if you guys picked any of these and I'm like, let's say you picked A, I'm not putting you down in any way. This is like completely brand new. I'm just letting you know. Which is, by the way, in my class, I give NCLEX questions every week, anywhere from 2 to 4, and they're not worth points, they're worth practice. And that's how we start our class every day, because I just want them practicing, because that's how you learn. So just wanted to make that little disclosure. Letter B, did your company give you a severance package? Again, in this moment of crisis, and like in this moment, now this may come up in the conversation. That's another hard part of like these types of questions. And again, this is how we test you in nursing school too. Is that this is critical thinking, and a different type of critical thinking maybe that you've been exposed to in the past. So this may still come up, but this is not the first thing I'm going to say, like, which of the following responses by the RN is most appropriate. It doesn't say select all that apply. It does. I can only choose one. So if I can only choose one, which one am I going to choose? So maybe later in the conversation, the patient does start talking about money and is worried. Maybe then it would be appropriate to ask this question, but that's not what this question's asking. Letter C, tell me what happened. I hope, honestly, I don't really love this question because that is the answer. It's open-ended, and it's not always this easy, by the way. As we go down, we'll see, like, it's not just the open-ended one. Then letter D, focus on the fact that you have a healthy, happy family. 1 and 2 are very similar. So tell me what happened, because I don't know, maybe this individual is now struggling with substance use disorder and has been drinking on the job, and has been written up for it. Maybe they're chronically late. We don't know what happened. And again, the more we know what happened, the more we can be of use and helpful. All right, number 3. A school-age child tearfully confides to the nurse that an uncle has been sexually abusive for the past 6 months. Which statement by the nurse is best? Now, this question does not give me a lot of information, so I feel that I mean, it does and it doesn't, but I'm going to go on the side that it doesn't. So the responses actually will help you guide your way to your answer. As you do more of these when you're in the program and you're studying and doing all of that, this will make probably a little more sense. But I know that I have a school-age child. Doesn't give me an exact number, but I'm just going to assume, because we kind of have to. School-aged usually means like, what is it? Kindergarten through like 6th grade. And they're tearful, so they're upset and they're confiding. And I can only imagine. So we have to know. The reason I mentioned the child part is we need to know about developmental. I'm not going to go into Erickson's and all of that stuff, but how we're going to communicate therapeutically with a child. So, and especially with such a sensitive case of sexual abuse, and it's been going on for the past 6 months. This little one's looking for some help. I think he said it's a boy, right? School age. I've done this 100 times. I just always assumed it was a boy. Okay, anyway. All right, letter A. Your secret is safe with me. I will not tell anyone until you are ready. Students love this one. It is therapeutic. However, a couple things are wrong with this one. Number 1, you are a mandated reporter. You're not saying you're not going to report it, but you're a mandated reporter. And what if this child doesn't want to? You're saying your secret is safe with me. I will not tell anyone until you're ready. Well, what if he or she, I swear it's a boy, whatever, we're gonna say it's a boy. He has been, he doesn't want to say anything before he goes home. That child is not leaving my presence until something is taken care of. So I'm kind of lying here. Your secret is safe with me. I won't say anything till I'm ready. So, I mean, we definitely don't want to set ourselves up for failure. And, this little guy, we want to make sure that he's safe. So I don't want to tell him something that's not true. Letter B. Would you like me to call the police to report this? Students also love this one because it's true. We're a mandated reporter. This is a child, I'm thinking developmentally. And that's why we read all the questions. This is scary to a child to hear, oh my God, the police, or maybe it wouldn't be. We don't know. That's why we don't assume. But because I've been doing this a long time and I know I have like the book that's told me the rationale of why it's right and wrong. That's the rationale. That would be very scary usually to a child. But that's another reason we continue reading on because we're not sure yet. Letter C, it takes a lot of courage to share this information. Now, although you're making a statement and it's not a question, I like this one best so far. But let's see letter D. How could your parents not see this has been happening to you? Absolutely condescending. Now you're blaming the parents, probably making the child feel very uncomfortable. It's just not an appropriate thing to say. So automatically letter D is gone. Letter A, your secret is safe with me. We're not doing that because of what we talked about earlier. Now it comes down to B or C. Which one would I say? I would do letter C because I know I'm going to have to call the police, CPS, something's going to happen. And but I also want to build that rapport, trust with my little guy here that's telling me some horrible information, and I want him to trust me, and I want to find out as much as he's comfortable to share with me, and then go from there. So the answer is letter C. Number 4, a patient with a diagnosis of major depression who has attempted suicide says to the nurse, "I should have died. I've always been a failure. Nothing ever goes right for me." Which response demonstrates therapeutic communication? Okay, so what I know is that we have a diagnosis. That's important. Major depressive disorder, major depression. And they did try to take their own life and seems pretty upset that they were unable to have it be successful. And then right after that actually makes them feel more like a failure because they can't do something that they even tried because they don't want to be here. They want to be gone. And now, what am I going to say that's therapeutic? Letter A, you've been feeling like a failure for a while. I'm going to say it one more time. Closed questions are not always wrong. This is not the answer, but this is an example of a closed question. I don't quite like it, but let's keep going. And quite frankly, I don't think I've ever had this question, so we're doing this together right now. You have everything to live for. Who are you to say that? Right? And it's, again, dismissive. It's not addressing what the patient is talking about. Letter C, why do you see yourself as a failure? Okay, I like that. It's open-ended. It gives me a little bit more information. Maybe we can get somewhere. And from how it kind of sounds with the exclamation point of "I should have died," maybe they're aggravated. I don't know, but this is going to give me more. And then the last one, feeling like this is all part of being depressed. No, absolutely not. Because now you're basically doing the "I should" or "you should do this," or you're telling them something. You don't know that. You have no idea. You have no idea if this is what's going on. And even if it is because he's depressed, and it probably is this the right time to say that? I mean, the patient's really upset, and it's probably only going to make things worse. It is not therapeutic. So the answer would be, why do you see yourself as a failure? And that's giving yourself to the patient as well. And, tone of voice, body language, and hopefully will help de-escalate the what's going on. Number 5, and also be able to help the patient feel like they're being heard and hopefully feel a little bit better and get to a point where medication gets on board and things, therapy, all of that. Okay, number 5. Totally sleeping. Did I maybe cut and paste this incorrectly? Oh, I just put A, B, or C. Sorry about that, guys. Number 5, when the community health nurse visits a patient at home, the patient states, "I haven't slept the last couple of nights." Which response by the nurse illustrates a therapeutic communication response to this patient? Okay, don't have very much information. I know that I do have somebody that is having trouble sleeping. And what am I going to say to basically help? It's not giving me very much to go by, but therapeutically, what am I going to say right after the patient says that? Really? That's like, what does that do? Like, and how do you think the patient might receive that? Like, it's not, there's no banter there to combat. It's kind of like, yeah, really. So next one, you're having difficult sleeping. That is validating. And it's restating, which, what did we just learn, is good. The next one, I see, is just like the first one, really, and I see. They are and can be therapeutic, but in this case, so do you see what, I hope this is all coming together from what we talked about in the beginning with therapeutic communication, because we know darn well the last one's not right. Sometimes I have trouble sleeping too. This is not about me. This is not about me. It is about the patient. And now, does that mean I may not mention that later after I say, so the answer is you're having difficult sleeping, and patient will hopefully elaborate, and we can have that conversation about, techniques that can help. Or I tend to ask, are you interested in techniques such as like meditation type of work? Are you interested in potentially over-the-counter medication that we can get prescribed? Or have you tried anything in the past that's worked? That's my favorite. And go from there. And then maybe I would put in somehow in the conversation about I have trouble sleeping sometimes too, and it can really, because I'm validating, and I'm not giving too much away. We want to be professional, and it can really, really affect my mood. It affects my entire day, and I would love for you not to feel that way. Boom. Beautiful, right? Okay, last one. The nurse provides care for an older adult client in an assisted living facility. Which client statement requires an intervention by the nurse? Okay, so again, doesn't give us too much. I know that I have an older adult and that this individual is making a statement. Oh, okay, so this is what I mean by going back. So which of these would require intervention? Meaning, which one of these is wrong? Because I would need to do an intervention and help. So that's why I say it's always important to go back and read it, because you might pick the wrong one if you don't, because you might forget what it's even asking. So which one of these is not correct and I need to intervene? I feel I have good advice to give onto my children, but they don't always agree with me. Okay. I don't see anything completely wrong with a patient saying that. It's probably true, especially if you that have kids probably understand that. Even though I did not graduate from high school, I was always able to provide for my family. To me, that's a pretty, positive statement. And remember, this is of older age. So what's happening here, the rationale behind it is older age and reflecting upon their life. And if like kind of looking back, like what was my life worth? And that may not be the best word, but just kind of trying to make this a little faster, because I know I said 45 minutes and I'm sure we're way over that. The next one, if I could live my life over, there would be so many things that I would do differently. So red flag already. And look what we did. Look at the first two compared to the third one. So already, doesn't that one feel way different? So that's a huge indication to me. And I'm like, got to keep an eye on that one, because this shows regret. And I would want to intervene and have a conversation with this patient and talk to them. And, well, again, open-ended questions. What do you mean by that? And hopefully, I'm not saying you have a magic wand and everything's going to be better, but I'm not just going to let someone say that and ignore them then and not get more information. And then the last one, I want to spend as much time with my grandchildren as possible. I realize I will not be around forever. Students love this one as well, but this is actually acceptance that unless you don't believe in this, everybody is going to at some point pass away. So this is actually a positive statement. So if we had to look at these, I'm going to cross out the bottom one right away. If we had to pick between the first three, it's definitely going to be the third one, because it's saying I would do so many things differently. Basically, they don't feel good about what they've done in their life. I hope this was helpful. Again, if you have any questions, let me know. We will be doing more of these. This is the biggest chunk. Usually we'll just do a couple. Because we have other things, of course, that we need to do. I'm gonna go ahead and get this uploaded, and let me know if you need anything, or if you have any just, I know I keep saying this. You're not bugging me. A lot of students feel like they're bugging the instructor. You're not bugging me. I'm here for you. So I hope you all have a good weekend, get done what you need to get done, and from there, I am done. I'm just trying to unshare this right now. So I'm just gonna keep talking until it's unshared.